It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: keys to the recovery of your dog after surgery. Because dogs can't tell us when they're not feeling well, caring for them after an operation can be very difficult. This is especially true if the pet is recovering from a surgical procedure. Some procedures, such as orthopedic surgery, require many months of recovery time. Soft tissue surgeries allow normal activity in just 1 to 2 weeks. When your pet returns home after her surgical procedure, you will be the one to monitor her health and make sure the wound heals properly. Here are the basic things you need to know to help your dog recover after surgery. 1. Provide a recovery space that is safe. Before your pet leaves the hospital, you should have everything ready to provide him with the most comfortable recovery space. Your pet will need plenty of sleep and a soft, quiet place to rest, with easily accessible food and water. Your dog will likely not be allowed to play or walk for a certain period of time because any strenuous activity can stretch and reopen the healing wound. A calm environment encourages your pet to rest. You can entertain him by playing nose puzzle games, like hiding a treat in one of your hands and letting him guess which one, or provide him with chew toys. If you have other pets, they may bother or try to play with the recovering dog, so it's a good idea to keep them in separate rooms. 2. You must know what to expect from your dog. After surgery, you must monitor all of your pet's activities to monitor her health. It helps to know what to expect and to consider your dog's temperament. For example, if you know your puppy will whine at the slightest inconvenience, he may have a more difficult recovery process. On the other hand, if you have a stronger, more energetic dog that is trying to recover from surgery like nothing happened, it can infect or irritate the lesion. Here are some normal things you may notice during the recovery process that should not raise an alarm. Sleep a lot. Decreased appetite right after surgery. Excessive thirst right after surgery. Keep in mind that drinking too fast can cause dogs to vomit. If your pet is very thirsty, ration water 1 cup every 15 to 30 minutes. Sensitivity at the surgical site. Small amounts of blood or discharge. These conditions are temporary and should go away in a couple of days or weeks. If your dog seems to be in pain, give him pain relievers as directed by your vet. 3. Look for warning signs. The most important part of the healing process is keeping the wound clean and safe. This will likely include a bandage around the surgery site and possibly a cone to prevent the dog from biting and licking it. Replace the bandage frequently. Keep a close eye on your dog's injury and behavior. Look out for any of these symptoms, which could indicate something is wrong. Pus or excess blood at the surgical site. Vomiting repeatedly. Crying, howling, whining, or pacing. The incision site reopened. Unresponsiveness, seizures, or loss of consciousness. If you notice any of these symptoms, call your vet immediately. 4. Consult your vet if necessary. All surgeries affect pets differently, so you should primarily rely on your vet's advice and instructions. He may give you a lot of guidance in this regard, so when you pick up your pet from surgery, it may be helpful to bring a notebook to write down all of the doctor's instructions. It's also a good idea to write a schedule for your dog's medication and wound care needs, especially if you're dividing care responsibilities with other family members. If you're ever in doubt about your pet's post-operative health, it's worth calling your vet to get their professional opinion. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend, a hunt, and until the next video,